Thank you for staying tuned to Channels Television. A warm welcome to Health Matters. I am Yomi Otaigbe. Pregnancy and childbirth offer a profound and transformative experience. The health of both mother and baby is paramount, making safe pregnancy and postnatal care not just medical necessities, but foundational pillars of a family's well-being. Today on Health Matters, we'll be looking into how to make the journey of pregnancy and childbirth safe for both mother, the child, and I dare add, the father. A nursing professional with over 30 years of experience in nursing and midwifery will join me in the studio in a moment. But do remember, your questions and comments are most welcome on the program. You can join us via this phone number 080-8054-2233 or reach out on X at Yomi_Otaigbe. To stay with us on the program. Welcome back. In an analytical fact sheet released in March 2023 by the World Health Organization and Integrated African Health Observatory, in the year 2020, countries with extremely high maternal mortality rates are South Sudan with 1,223 deaths, followed by Chad with 1,063 deaths, and Nigeria with 1,047 deaths per 100,000 live births. As part of efforts to reduce these numbers for Nigeria, we'll be focusing on safe pregnancy and postnatal care. To share from a wealth of experience, I'm now being joined on Health Matters by a registered nurse and midwife with over 3 decades in nursing that has spanned through clinical school and currently at the policy level. She's a fellow of the West African Postgraduate College of Nursing, Nurses and Midwives, and Director of Nursing Services, Lagos State Ministry of Health, Mrs. Olushola Aketi. Thank you so much for being here.
Good afternoon, ma'am.
Thank you.
Having me.
So, this is what you do. This is what you talk about. This is what you've been doing for almost, it's about 35, 38 years now, thereabouts.
From the school till now, it's over 35 years.
Wow. So, when should that journey of pregnancy begin? Is it when the pregnancy started or starts or just before it?
Thank you so very much. Once again, it's a pleasure to be here. And I remember during COVID, this is the way we do it together. Once again, thanks to the management. Pregnancy is a journey that should be prepared for. But some comes as a result of unprepared. Whether we like it or not, it's a kind of situation where you have to prepare yourself because of the challenges. It's supposed to be a physiological transformation, so to say, but along the line, it comes along with some complications that should be prevented before they happen. And pregnancy, for instance, for those that are married, it's already planned for. But those that did not plan for it, when it comes, they should also plan for it, because a journey of 9 months is not just a thing you can just push aside. So it should be properly planned for, it should be properly prepared for, both physically, psychologically, in all aspects, even economically.
So when the pregnancy itself starts, what should that pregnant woman and her partner know or do?
Thank you once again for this advocacy. As I would say, whenever any person discovers that she's pregnant, you are the first person to identify you are pregnant through the tests you carried out. There are so many self-tests you can do, self-care tests you can do. What the person's supposed to do is to report him or herself to a medical expert, obstetrician to be precise. Often people don't know they are pregnant until...
I wanted to say so, that because you said when you are pregnant, you should know you are.
Later months. For instance, some carry it to 5 months, they don't know they are pregnant, depends on their body composition. But by the time you start seeing some signs and symptoms, vis-a-vis, you're feeling sleepy early in the morning, you're trying to throw up, you see yourself getting fertile, especially on the features, feminine features, breasts and the likes, itching, and some other symptoms that you can personally confirm, it's better to go for such checkup. However, once you identify you are pregnant at week 16, it's expected for you to register with a competent and expert so that they can monitor your pregnancy.
So that is, that registration can happen at
supposed to be
the
from
primary
16
health
weeks.
center or the hospital?
For instance, in Lagos, they have made it so convenient for everybody. 10 minutes away from where you are, you can get access to for care. So primary health care centers, they're all over 324 of them in Lagos State, and so also in federal institutions, because we ensure that that life should be preserved with the baby that she's carrying. So you should avail yourself the opportunity to visit the primary care center or secondary level or even tertiary, because all these hospitals, they offer this kind of services to prevent the mother and the baby.
Okay, just before we go into what you will need to learn at those antenatal clinics, some people would not go to health centers.
Okay.
They will not go to the hospitals. They will go to the traditional birth attendants.
For sure.
What would you advise in that line?
Culture is dynamic. You don't devise a man from his culture. So our cultural basis, let me visit traditional birth centers or faith-based. I can say Lagos State, Lagos is leading that wise to ensure that the traditional birth attendant or traditional birth centers are well monitored, regulated, and being checkmated. Why do we say so? We don't want their inclusion to add to the already challenged maternal mortality rate. So even the faith-based, everybody is now under check. So when they get to them, there are series of lectures that have been put in place to ensure that this is where my limitation ends and I should be able to refer. So we inculcated that in the training for them, and there's a regulation to that effect. So when they visit them, especially the first timer, we call them primary gravidae, we ensure that you don't attend to them, refer them. But don't forget that we inherited this traditional birth, whatever. But whenever they are with them, because we do facility assessment, it might not cover all. They do that according to their district, especially in this state, to ensure that whatever you are offering is useful and more appreciated than you contributing to already existing challenges we have.
That woman is also registered at a government facility, right?
Once they come to the government facilities, what are the things we carried out? Number one, education. We educate them on the importance of the pregnancy and the likely challenges they are like to have, especially the primary. That because you have your first pregnancy does not mean you are not going to have another challenges in your subsequent ones. It's just by divine grace and His providence that we have all these benefits to ourselves. So health education about themselves, about the changes they expected, about the environment, health, about the care in terms of the environment,
to eat.
In terms of neatness. Some of them, the environment contributed to whatever they are going through. Then talk to them about nutrition. Not only that, we carry out some tests. They will need to see the OBGYN doctor who will prescribe some kind of test for them. But before then, we do some examination, physical examination. We palpate as well to know the length and everything that needed to contribute to their growth in the course of their maternal journey. So all these are carried out during antenatal, and that's why antenatal is a very fantastic place. They network, they meet with others, they ask questions. In most cases, when they come like that, we notice some younger ones. What do? We partner them with those that had pregnancy before, that they can ask from her. She has gone through it successfully, or to build their confidence and ensure that, yes, they know what they are doing. However, during the antenatal, like I said, it's a social network kind of, that we allay their fears. We are in an era, at a click of the button, you can get access to information. But prior to this time, we have so many local that advise them in another way that they will, but it contradicts to most of the time what we do tell them. So we ensure that we make our relationship closer to them, starting from establishing a good rapport, starting from ensuring that you trust me. For you to trust me, my attitude should speak to that, and many other things that are put in place to ensure their safety.
So that is, you must attend
Antenatal
antenatal,
clinic.
and there you get to hear a lot about how to care for your pregnancy.
For real.
We'll talk about nutrition, good sleep, because all of this will tie together, you know, in this journey that we are talking about. But we'll go on a quick break, and when we come back, we'll be talking more about safe pregnancy and childbirth. Just stay with us on Health Matters. You're watching Health Matters on Channels Television, and we've been discussing safe pregnancy and childbirth. Don't forget, you can join us in this conversation. The number to call is 080-8054-2233, which is on your screen. Now, let's go into nutrition, because that is also very key for the mother and the child.
Thank you very much. Nutrition is everything. The way you eat is the way you look, or the way you live. Nutrition in pregnancy is taken optimally. Why? The baby depends on the mother to live. And so if you are not well fed, it will affect your general composure and internal milieu. Children are endowed to ensure that they live well through their mother's nutrition. And that is why iron, folic acid, and other supplements are mandatory. I would call it mandatory. That's why then they come to us, we give them all these supplements, and we check. In fact, the midwives and nutritionists, Nutrition Organization of Nigeria, we are working together, all to ensure that that baby is well kept. If the mother is not well fed, it will affect the baby, and they will come out with various kind of challenges vis-a-vis some anomalies, birth defects, and some other things that are preventable through nutrition. As well as we ensure that the mother, because they get tired easily. So if they didn't have enough in their system through their nutrition, it will affect their daily output. So we try to ensure that we give them adequate nutrition. Even we carry it out. So in fact, they ask questions, practical questions. What do I do? For instance, when they're preparing vegetables, they will have burned the vital ingredient inside that vegetables. So we ensure that we practicalize it where the opportunity comes. That is practically what we do. We don't just rush with them because they are coming to the clinic. When they are coming to the clinic, their husband, even at work, they know you are going to go. It's like a whole day after. Not because we are coming to waste time, but because they are coming for information. Information is vital, and nutrition play a significant role. And when we find out through the check, and we do the test we have recommended that they are not up to the expectation, we try to tell them how to augment, what to take, what to do, apart from all these hematinics, that is blood forming tablet. We still encourage them to take the supplement, the nutrition of optimal importance.
Okay, so let's talk about sleep. I know a lot of pregnant women will sleep naturally, but some may find it difficult. How can they go about this, helping themselves?
Let me start by pleading to the men folks. This is the time they should care for these women. They should pamper them. They should know that they are not the only one. Most of when they are carrying more than one pregnancy, is a load of challenges or burden on them. So sleep will come when most of the household chores they do is reduced, more especially when they even have toddlers. It's like having the whole house full of the younger ones. The one in the uterus is battling for survival. The one at home. So I want to plead with the support system in the house to be ultimately increased. From the sister-in-law, mother-in-law, sister-in-law, the husband, and everybody
around the pregnant
and don't
woman.
forget that we are living in a mega city. Everybody career, but that woman should be given adequate care to sleep well, to rest well. Not everything, especially when the mother-in-law comes around, you must find your manager. Not that period. You should be the one to care for this younger one.
Okay. So let's talk about, mental health issues also come up during pregnancy. You find some women, really, really overwhelmed by all of the emotions and, the physiological changes. How can they manage that? Is this something that they also need to seek help for?
Sincerely, you are speaking my mind out. It's one of the points I was about to raise. On the 31st of July, we had a gathering by even advocacy. What about? It's about mental health, depression, prenatal. Many of these pregnant women go through this mental health depression and nobody takes cognizance of it. We look at it as a normal thing. It's not normal. Pregnancy is supposed to be a physiological, but there are some, like I said, challenges that comes along with it. And so in order to relieve this burden, the family support should be strong. How? Adequate rest, like I said. The moment you notice that, you give attention to that by calling on the experts. And that is why we have some app that will soon be developed on how to, when they come to the clinic, they manifest it. And so that app, when you give it to them, they assess it, be able to tell you the level at which they are. Maternal mental health has been a great challenge. And it's now becoming a public health priority. That this area we should look at it. Why? We don't want to lose that woman after childbirth.
Okay, let's quickly be joined by our caller. Hello, Philip. Hello, Philip. Thank you for joining us on the program. Okay, I think network is having some issues there. So it is important for, the mental health of that pregnant woman is very important.
In fact, I may say, in Lagos State, we do something telemedicine. You don't just come, especially for those, Lagos State is coastal environs. For those that comes across water, we do go to them. But where they could not afford to come, especially when there is flood or increase in water level, we make a call across to them. If only the network permits, often than none. To call them, how are you faring today? Can you assessing them through telemedicine? Because we follow a pattern in Kenya where midwives go to the exterior, which we do. But because of the water and other factors, we ensure that we enhance this telemedicine for them for easy communication and know their mental state.
So let's quickly go to after that child is born safely.
Okay.
What are those steps, to take care of not just the mother now, also the newborn?
Before the baby is born, it is expected of you at least 8 visits to that center, at least from week 16 to 38 weeks. We make it, I'm going back to the pregnancy, right, because I'm going to try into. We make sure that at 4 weeks, that is 1 month, till you are 28, from 28 to possibly 30 to 2 weeks. And between that 36 and 38, it should be every week. Reason being to enable us assess you. That will enhance how you come out well at postnatal. The problem that we did not identify at the initial stage can be identified towards the tail end of your visit. And that will enable us to know how to prepare for your delivery. Often during that pregnancy, some people have pregnancy-induced hypertension, gestational diabetes, and the like. And when they put to bed, preeclampsia, if it's not properly managed, it will see into the postnatal. And postnatal, we ensure that adequate care is given. Concentration. When you give them due concentration, you allay their fear, you sing for them, you make them to know that you are because they are the one bearing it. Redeeming contraction should be observed to be redeemed. Where they fail, you quickly give an alternative, which is mostly CS. And not even only that, you prepare them for, in case they need to, for this big baby, for those that have gestational diabetes, you give them sit baths at home. Before leaving, your first 24 hours is to them. And after that 24 hours, between 48 to 72 hours before leaving the hospital, if they are within the hospital, you should give them that kind of visit. And 6 weeks postnatal is important. And while they are in the hospital or before leaving, immunization of that child, BCG is optimal, and Peterson. Once they have that, you give them the appointments for subsequent visits. But the same thing because when they are going home, their low care will be different along the line. That is the blood that comes from the mothers after delivery, that place will still be. They should look at the low care and ascertain that there's no sign of infection, there's no cause for alarm before you discharge them home, and you give them adequate treatment. They can read anything online, but the one you are telling them should be the one they hold on to. And they ask questions. You've got to see when they ask questions. And that gladdens us because it's an indication that they want to learn, they want to live on the premise of what you have taught them.
So you mentioned the alternative to, normal birth, which is surgery.
Cesarean section.
A lot of, or some people really don't want to talk about that. Once you say so, they don't want to. Why is this important conversation to have?
Cesarean section is safe, is good. The only thing is that you go through some pains for some time. In fact, in advanced countries, statistics show that they prefer the cesarean section than normal delivery. But spontaneous delivery should be encouraged where it fails, or you have identified that this patient, because of descent or as another contributory factor, they subject them to cesarean section. For the cesarean section, once that is done, that is why you must go to where the experts are. There are many, they are available. Shogun is advocating for it, that let these women come to us. That is Society for Gynecology. Same thing, the midwife, Nursing and Midwifery Council of Nigeria has ensured that this is at the area you have to monitor your clients with our curriculum at par. And not even that, the cesarean section in question should ensure that patient is safe, the mother too is safe. It shouldn't be at the tail end. It should be a planned thing. But often than not, we find that most of our government hospitals that they just rush it at last minute. And that's why this advocacy should go to them. Don't delay in referring the patient. Once you discover you cannot,
better outcomes.
Yes, once you discover you cannot help. And that's why, please, I want everybody to know that not everybody that delivers a baby is a midwife. They have them out there, and we should not contribute. Lagos is already doing something to reduce this maternal mortality rate through this, because delay referral, infection, and other complications have been identified from the statistics, from this research, that they are contributory factor. And the best way to nip it at the ball, refer as early as possible. As
early as possible. Thank you so much for your time and experience that you've shared with us today on the program. We've been having a chat with a fellow of the West African Postgraduate College of Nurses and Midwives and the Director of Nursing Services, Lagos State Ministry of Health, Mrs. Olushola Aketi. Thank you so much for your time. And just before we go, we have for you the news making the rounds in the health world. Do stay with us.
World Breastfeeding Week. The Lagos State government says it has recorded a significant milestone in child nutrition, with its exclusive breastfeeding rate rising to 57.4%, surpassing the global benchmark of 50%. The state's special advisor on health, Dr. Kemi Ogunyemi, revealed this during a press conference, adding that the state government is working assiduously to address the 14% low rate of early initiation of breastfeeding within the first 4 hours of birth, which poses serious implications for neonatal health.
The theme for the year 2025 World Breastfeeding Week is Prioritize Breastfeeding, Create Sustainable Support Systems. This highlights the need to improve awareness about the long-term health benefits of exclusive breastfeeding for both mothers and children, as part of ongoing efforts towards reducing under 5 mortality rates. It is also to foster very supportive environment for mothers, especially the working moms, ultimately enhancing the well-being of both mothers and their babies. It is our collective responsibility to see that every nursing mother has access to the support and information she needs to breastfeed by investing strongly in maternal, infant, and young child nutrition strategies and practices to support and empower women.
Thank you so much for staying with us as we wind down on health matters. Remember that safe pregnancy and postnatal care involve regular prenatal checkups, a nutritious diet, adequate sleep, and self-care to support both the mother and baby's health. That's it on the program. See you again next week. I am Yomi Otaibi.